I warmly welcome you all. Sorry for the bit of delay. Because we are all in English now, I think it's good to go ahead in English. You want it in a Tamil introduction? No. Yeah. I'll go with English first. It's my pleasure to welcome Dr. P. Selvashunmugam today for the Auroville Festival Humilate 2025. Doctor holds a degree in Siddha medicine and a PhD with over 16 years of research experience in integrative Siddha and modern medicine. He currently serves as the Secretary and Siddha consultant at the Health Foundation India and is the founder and president of the Global Center for Siddha Medicine and Research. He is an esteemed member of several research and national advisory boards under India's Ministry of Ayush, playing a vital role in developing competency-based education for Siddha medicine. Dr. Shunmugam also serves as an adjunct professor at the Morehouse School of Medicine, USA, and visiting faculty at the Manipal Academy of Higher Education. Throughout his career, he has authored numerous research papers and successfully coordinated a WHO-sponsored project on Siddha treatment guidelines. His contributions have been recognized globally, receiving awards from organizations such as FETNA USA, American Tamil Medicine Association, and Academy of Integrative Health and Medicine. Today, our doctor will speak on the topic, an integrative Siddha medicine approach to health and well-being, exploring how Siddha and modern medicine can work together to promote holistic health. As we all know, Auroville is a place of learners and research community. I have been telling Professor that it's a research center in itself. And most of us are a bit of conscious, and I warmly welcome you all once again and thank you for the opportunity. Professor, please welcome. Thank you.
Another 20 to 30 minutes, I will I will sprinkle the knowledge of traditional Siddha system of medicine and explore further more to you. Okay. So, Siddha system of medicine is the ancient medical system of India. So, I would like to introduce. First slide, please. So, today we are going to learn the origin and current practice of traditional Siddha system of medicine, understand the fundamental theories of Siddha system, and understand the basic diagnostic methods, that is the pulse reading examination and the urine examination, understand the concept of the primordial preventive methods mentioned in the ancient Siddha literature. And the last one is the non-pharmacological approaches. So, what are all the daily routine? What are all the day-to-day active to enhance our immune system, enhance our health, to prevent the modern challenging diseases? Okay. So, next slide, please. So, currently, not only India, this is the statement from the India, but all over the world, the medical expense for the health care system is highly huge. In India alone, 1.9 GDP is from 1.4 to 1.9 increase from the last year to current year. So, some private organizations, some non-governmental organization and individual families are expense more for the healthcare system. All the amount is, next slide please, all the amount is going to treat some diseases itself. So, next slide please. So, it is not for the mental health and physical health, it is not for the emotional intelligence. The amount is going to either vaccines, either treatment of the disease, or early diagnosis of some diseases like diabetes mellitus, hypertension, early detection of the cardiovascular system. So, it is not the amount not spent for the physical or mental health or for the primordial preventive methods of the traditional medical system. So, we need to focus on the primordial preventive methods mentioned in the ancient medical systems. So, next slide please. So, you are well known about the word health and wellness. So, WHO defined the health as a state of complete physical, mental, and social well-being, not merely the absence of the disease or infirmity. This is the definition of WHO. So health is the goal, wellness is the pathway. Wellness is more of lifestyle, diet, and yoga. Health is the goal. Next slide, please. So this definition is mentioned in the ancient Siddha Tamil literature. There is a மறுப்பது உடல் நோய் மருந்தனல் ஆகும், மறுப்பது உள நோய் மருந்தன சாலும், மறுப்பது இனி நோய் வாராதிருக்க, மறுப்பது சாவையும் மருந்தனலாமே. 2000 years back, the ancient Siddhar, it's okay? Okay, right. So ancient Siddhar, one Siddhar is called Tirumular, sage scientist, mentioned in his literature as the therapeutics or medicine is one that cure physical ailment, psychological ailment. Medicine is one that prevents the disease. The fourth one is a very, very important. Therapeutic is one that bestows the immortality. The medicine for immortality is the unique concept of Siddha system of medicine. Next slide, please. So these are all the 6 compartments of the wellness. So physical wellness, emotional or mental wellness, intellectual wellness, social, occupational, and spiritual wellness. Next slide, please. So through the current science and through the current medical equipments, we live longer. So even a single drop of blood, with a single drop of blood, we can diagnose a future ailments 5 years after ailment also diagnosed today with a single drop of blood. But at the last line is that at the same time, more and more becoming seriously ill. Majority of the challenging diseases are evolving day by day. That is resistant bacteria, non-communicable diseases. These are all the challenges to the modern medical world. Next slide, please. So, current medical world, there are 2 important questions, very important. First one is what are all the managements for the challenging diseases to the modern medical world? The number 1 is the autoimmune conditions. So, rheumatoid arthritis, psoriasis, and autoimmune diabetes mellitus, autoimmune based cancers. These are all the challenges to the modern medical world. So, what are all the management strategies to overcome this type of condition? This is one important question. The second question is, how do we prevent these type of challenging disorders in the future world? So, we are trying to integrate traditional knowledge to overcome, to prevent these type of challenging diseases to the modern medical world. So before going to that primordial prevention, I would like to emphasize some basic fundamental principles of Siddha system of medicine. So next slide, please. So Siddha system of medicine is the origin of Siddha system of medicine is approximately 10,000 years back. One of the ancient medical system of the world. So based on the eternal wisdoms of the Siddhas, ancient scientists, so this science is evolved through the introspection and meditation. Next slide, please. So the knowledge of the Siddhas, ancient scientists, is transformed to the one generation to the another generation through palm leaf manuscripts, copper plate inscription, and stone inscriptions. So in 1997, UNESCO is recognized Tamil palm leaf manuscript at the Heritage Registry. Next slide, please. So next. So we are going to see the fundamentals of Siddha system of medicine. So the fundamental is very, very strong and deep. So now we are going to see some superficial aspects of that fundamentals of Siddha system of medicine. The word is Andathil ullade pindam, pindathil ullade andam. Here, andam is universe, pindam is our body. The fundamental principles or primordial principles of our body as well as the universe is the same. What are all the primordial primordial elements? Earth, water, fire, air, and space. These 5 primordial elements is base for our body as well as the universe. It is not only for the body as well as universe. All the materials present in the universe is based on these 5 primordial elements. Next slide, please. So, earth, water, fire, air and space. So, earth you mean mass and inertia. So, the movement and higher intellectual functions are based on the air principle. Water, fluidity, fire, heat, air, movement, and space is the spiritual aspect, more on spiritual aspect. Next slide. So, according to Siddha system of medicine, these are all the fundamental tissues of our body. First one is the plasma. It is mentioned as the saram. Blood, that is sennir, muscle tissue, fatty tissue, bone marrow, and the reproductive materials. These are all the 7 fundamental tissues according to Siddha system of medicines. All the 7 fundamental tissues are made up of that 5 primordial elements. For example, you can choose the enbo or bone material. There is a earth and air is the base for forming the bone material. So, based on the 5 primordial elements, these 7 fundamental or primordial tissues are evolved as per the Siddha literature. So, in other ways called, these are all the anatomical part of our body. The next slide put. So, these are all the functional part of our body. Vadam, Pittam, Kabam in Ayurveda, but in Siddha, Vali, Alal, Ayam. So, Vadam or Vali energy is more or less equal to the kinetic energy. The fundamental primordial principles are air and space. It is more responsible for the higher intellectual functions and all the movements of our body. The next one is the Alal or Pittam. This is more or less equal to the thermal energy. It regulates the body heat, digestion, appetite, all the metabolic activity of our body is come under the thermal energy. The last one is the Ayam, that is Kabam. It acts as the binding material. It is more or less equal to that of static energy or potential energy. Next slide, please. So, these are all the 6 tastes according to Siddha system of medicine. 6 tastes mentioned. The 6 tastes is fundamental elements are also come the 5 primordial elements. So, sweet, sour, salt, bitter, pungent and astringent taste. Their actions and common sources are also mentioned in the ancient Siddha literature. Next slide, please. Can move the next. So, embryogenesis. So, functional part as well as the anatomical part coming from the paternal and maternal components. The 7 fundamental tissues and life energies is coming from the father and mother. And the spiritual component, there is a 5 sense organs, that is a touch, taste, smell, hearing, vision, and the intellectual part is coming from the spiritual part of our body. So, this is the unique concept of our creation. Okay. Mic, sound cake, please. Okay. It's not working. Okay, no issues. Okay. So, this is the unique concept according to the Siddha system of medicines. So, next slide, please. You can shift to the next slide. Previous one. Okay, next. So, these are all the unique components of Siddha system of medicine. The first one is the Kaya Kalpam, procedure of rejuvenation. This is the science of longevity, come under the Kaya Kalpam. Attanga Yogam, you can heard about the word yoga previously and you are doing yoga regular basis. So, you well versed about the 8 divisions of yoga. So, Muppu is the unique component of Siddha system of medicine. This is the superior form of elixir. It is the very higher level of medicine. There is a medical part. The Varmam is the unique component. This is the life center in the human body. by stimulating that particular centers, we can treat some diseases, especially musculoskeletal disorders and psychiatric issues are treated well by the Varmam therapy. Autism spectrum disorders, pediatric mental psychiatric illness, anxiety, depression, and some other musculoskeletal disorders like Parkinson's disease, arthritis, and muscular degenerations. These are all treated by the Varmam therapy. Rasavadam is the alchemy, transmutation of one element to the another element. This is precursor for modern chemistry as well as the modern pharmacology. This is the Rasavadam. 8 unique type of diagnostic parameters. We are going to see 2 parameters today. So these are all, we have 8 different type of diagnostic parameters in our wrist. Circumetric sign is also a diagnostic parameter. Manikadai Nool is also a diagnostic parameter. Unique internal medicines and external applications. 32 types of internal medical medicines and 32 types of external medical applications are also mentioned 2000 years back. Next slide, please. Next. These are all therapeutic. We are using medicinal plants, metal, minerals, and salt, and living products, animal products. Next slide, please. We are using more than 2000 medicinal plants, metal, mineral salts 225, and animal products we are using 185 animal products we are using in Siddha system of medicines. These are various preparation methods. Next slide, please. So currently we are preparing that medicines under the guidelines of the Indian Government of India, Good Manufacturing Practice and Drug and Cosmetic Act under the Government of India. We are preparing 32 types of internal medicines. We currently transform it into syrups, capsules, soft gelatin capsules. We are using modern technology also. Next slide, please. So the diagnostic parameters. There are 8 different types of diagnostic parameters are mentioned in the literature. So we are going to see the Nadi and urine examination. Pulse reading is a unique for Siddha system. So are you able to see the pulse? Yeah. So most prominent point, we just palpate with the index finger, only index finger. Are you able to palpate with the index finger? Yeah? Right. You register in your mind. The same point, you just palpate with the middle finger. The same point. Yeah. You can now palpate with the ring finger. All are same, different. It's different? Mostly same to me? Okay, we will discuss after. Okay, so same point, 1, 2, 3. We can interchange the fingers. Use 3 fingers. These are all the 3 instruments to assess our bioenergy. So we can assess the kinetic energy through the index finger, thermal energy through the middle finger, kinetic index, thermal middle finger, and potential energy through the ring finger. These are all the 3 instruments to assess the 3 parameters. Okay. So next slide. Next slide, please. So if the force, we can assess 2 things. One is the force, the another one is the movement of the pulse wave. The movement is like that. That's a gait is like hen, tortoise, and snake. If you one beat like projection or one beat like amplitude, and the movement like hen is called vadam or vali. And off beat like amplitude and the movement like the tortoise is called alal. And the quarter beat like projection and the movement like the snake is called ayam or kabam. So these are all the method of identification of 3 nadis, the pulse according to Siddha system of medicine. The ratio is 100%, 50% and 25%. Next slide. This is the normal nadi pattern. This is the Vadam, Pittam and Kabam. Yes, Vadam is 1 beat like amplitude. Half beat like amplitude is the Pittam. Quarter beat like projection is Kabam. So the gait is hen, tortoise and snake. This is the basic fundamentals of pulse reading, pulse examination. You can examine your pulse. The better time is morning 5:30 to 6 o'clock. Next slide, please. Next. Next slide. Next slide. Okay. So here is the pathological part, pathological nadi. Instead of 50%, the allele is double. With this modified pulse, we can suspect hypertension, mental disorder, peptic ulcer, fevers, and some other pathological conditions. We can diagnose with this pulse. And thousands and thousands of pulses are mentioned in the ancient Siddha literature, and each and every pulse has unique pathological parameters. Okay. Next slide, please. Next. So another one diagnostic parameter is urine examination. So early morning urine sample of a patient is analyzed by dropping 0.2 ml of sesame oil on the surface of the urine sample, and the patterns of the sesame oil, based on the pattern and the figures, we can diagnose some patients. Next slide. In Siddha, there is a Arivagunattai Ariyadanattai Aridarukuriyal Maruvinruyirke. If we see the shell formation or throne formation or the lotus formation, you can see the sample, it is normal. This is more or like shell formation. Next slide, please. This is ring with pearl. You can see the difference. This is urine sample, this is sesame oil on the surface of the urine sample. Next slide, please. This is beetle leaf formation related with the bronchial asthma patient. Next slide. This is diabetic patient before treatment and after treatment. If we see some abnormalities in the urine sample, that is a drop of oil in different shapes, we can give some medications. After the therapy, the slow dispersal may occur. A drop of oil on the surface is slowly dispersed. It is come under the control. It is not easy. it is tough. It is we will discuss. It is very, very unique parameter. So we see some more photographs and we discuss. Okay. Next slide, please. So this is a HIV positive patient's urine sample. So CD4 count is very low. Viral load is very high in that particular patient. Next slide. This is also another HIV positive patients with very low immunity and very high HIV viral load. Next. So in 1998, we see a huge number of HIV positive patients in our clinic. So all are very poor. So they are not able to afford the amount for investigations. So viral load 6,000 rupees per sample and the CD4 1,400, 1,500. In that particular condition, we are giving medicines. So how it work? We go to the literatures of the system of medicine. One book is called Therayar Neerkuri Neikuri. That book mentioned the normal person's pattern, common ailments or common mild, easily curable formations, and incurable or very difficult to cure diseases are mentioned in the literature. Based on the literature, we investigate with the HIV positive patients and some challenging disease conditions. It is very useful unique parameter for non-invasive parameter. Okay. So next slide. So we are going to see the primordial preventive methods. So before going to the primordial preventive methods of Siddha system of medicine, there are three major divisions of treatment. The first one is the KAPU, prevention and protection. NICAM means eliminate the disease and disability. This part is mainly concentrated on the modern biomedical system. The third part is also very unique, Niraipu, restoration of the people after any major ailment. So for example, if in last 3 or 4 years, COVID, so once COVID negative, he is okay, discharged from the hospital. He is not completely cured. So after negative viral load or after negative of the COVID, they have certain clinical symptoms. So complete recovery only after the Niraipu, restoration of the full potential after any ailment. If you are treating some tuberculosis or some typhoid fever, so after typhoid fever, recovery from the typhoid fever, we are giving some rejuvenating herbs and rejuvenating herbo-mineral preparations, and we advised some yoga. We are giving some oil for rejuvenating the entire system. So this is come under the Niraipu. It is also unique to our Siddha system of medicine. Next slide. So modern biomedical, next photo class. Next slide, please. Okay. So in modern biomedicine system, there are divisions of prevention. The primordial prevention come under the prevent the development of the risk factor. So primary prevention, manage the risk factors. Secondary prevention, early diagnosis and prompt treatment. And the tertiary prevention is the reduce the complication and disability. These are all the classified under the modern biomedical system. So in Siddha system, Pini Anuha Vidhi, that is a primordial prevention is the prevention of the root cause of any diseases is called primordial preventive method mention. So next slide, please. We are going to see some preventive methods and going for the discussion. So this is circadian rhythm. You well known about the circadian rhythm. 24 hours, the biological clock in our body, and it is very systematically sync with the environment. So in initial slides, we discuss about the andathil ullade pindam. So our body and the universe is the same. So we need to understand what are all the biological, physiological functions in our body, and we clearly observe the universe, and we need to formulate the primordial preventive methods. This is very, very useful for prevention of the modern challenging diseases. Okay. Next. So these are all some primordial preventive methods of traditional Siddha system of medicine. Next slide, please. So these primordial preventive methods come under 3 categories: lifestyle modification, diet management, and Siddha yoga. So it is clearly accepted by the World Health Organization under the topic of self-care. Next slide, please. So next. So there are 2 differences. One is the Naal Olukam, daily chores. The second one is the Kala Olukam, seasonal chores. According to Siddha system of medicine, the waking up time is 4:30 to 5 o'clock. It is very, very important for teaching the society for primordial preventive methods. Early morning waking up prevents many psychological, many physical ailments with the normalizing the vital energy of our body. It is closely related with the next slide, please. It is closely related with the neurotransmitters present in our body. You know very well about the serotonin, melatonin, endorphins. Endorphins means the endogenous morphine. It is morphine-like chemical, neurochemical is secreted by our brain and the neuro cells. It enhanced only in early morning, waking up in the early morning. Okay, next slide, please. Next slide. Next. So next one is we need to avoid the artificial toothpaste. So toothpaste contains artificial coloring agent, artificial sweetness, and many other things. So one of the most dangerous chemicals is SLS, sodium lauryl sulfate, nicotine, triclosan. So sublingual absorption of these dangerous chemicals entered into the system, it directly go to the immune cells and it directly going to attack the hormones. So we need to avoid this type of minimal damage to our body. So we avoid all the toothpaste. We analyzed more than 2000 toothpaste available in all over the world. All are contains at least 16, average of 16 dangerous chemicals present in our toothpaste. So don't encourage to use the toothpaste. Next slide. How do we alternate to the toothpaste? So in early days, our traditional Siddha system mentioned more than 50 herbs for oral cleansing. The one of the easiest way is a Triphala Churnam. You know very well about the Triphala Churnam. Kadakai, Nellikai, Tantrikai. The Kadakai means Chebulic myrobalan, Indian gooseberry, and Belleric myrobalan. These three combination is very easily available in all over the world, almost all over the world. So the combination is Triphala Churnam 100 gram, clove 5 gram, sea salt 5 gram. This is a simple, easiest method for cleaning the tooth and oral cavity. So the sublingual absorption of the Triphala Churnam enhance our system. It enhance our GI tract. It enhance the gut microbiome. It cleanse the whole system. It stimulate the activity of the liver enzymes. It also stimulate the neurotransmitters in our brain. So usage of simple tooth powder is also elixir according to our Siddha system. Next slide, please. So tongue cleaning, you know very well. Next. Oil pulling or swishing with the sesame oil or ghee. You can use once in a week. Next slide. So drinking adequate water in the early morning is useful. You know very well about more than 70% of our body is water. So don't start with the day with the deficiency of water. Next. 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 Next slide. So the unique concept, some of you may know about the cold rice fermented water. So the rice soaking in the adequate amount of water overnight, the next day you get a very good elixir that is called Neeraharam in Tamil. It contains very trace elements, amino acids and rare vitamins is present in our body. So it doesn't contain vitamin B6 or B12, but drinking of this elixir can stimulate our gut microbiome to produce vitamin B12 and rare vitamins. It is very useful. Next slide. Next. So many recent research reports can in the palaya soru, that is old rice or cold rice fermented water, can prevent the challenging intestinal conditions like irritable bowel syndrome, inflammatory bowel disease and Crohn's disease. Next slide, please. So you can switch to the Western toilet to Indian toilet because of the fecal stagnation is base for many diseases. So by avoiding this type of fecal stagnation, common allergy to the major diseases can come through using the Western toilet. So please avoid using the Western toilet. Instead of using Western toilet, that type of stools is available in the market. We can use that changing Western toilet to the Indian toilet. Next. Next. Next slide. Next slide. So by the way, we can also avoid soaps and shampoo. So the same materials. So parabens, triclosan and antibacterial chemicals are also present in our soaps and shampoo. It also dangerous to our innate resistance system. So our body mechanism, whole body is covered with the natural bacteria. So the natural bacteria prevents the pathological bacteria or protozoa or some other pathological microorganisms. So by using the antibacterial lotions and antibacterial soaps, we damage the system. So also common allergy to the infection come for the skin infections is common for using this type of soaps. Try to avoid with the herbs. Next slide, please. So alternative soap, the Panchakalpam is also 5 herbal combinations is also available. Next. So these are all the natural products. This is Pasipayir, green gram, Puvandi Kottai, that is the nutmeg, black seed, sandal. These are all the herbal alternate for soap. Next. Oil bath. Next. So if we are using the modern chemicals, we are at the risk of NCD. NCD means a non-communicable disease. Non-communicable diseases come under the lifestyle disorders. These are all diabetes, hypertension, autoimmune conditions, some cardiac conditions, some cancers. These are all come under the NCD, non-communicable disease. Next slide, please. Next. These are all some natural eyeliners are mentioned in the 2000 years back. Next. So these are all the taste. We should avoid white sugar, table salt, chili and tamarind. Instead of using the white sugar, we use palm sugar, honey or fruits. We can use instead of using the table salt, we can use sea salt or rock salt or black salt. So reduce the usage of chili. We can use pepper, ginger and garlic. Reduce the usage of commonly used tamarind. We can use the Garcinia camphorgia. This is the plant. Currently, this Garcinia camphorgia is used in the Kerala. It is called as the Malabar tamarind, Kudampuli or Palampuli in Tamil. So try to reduce the usage of the common tamarind, increase the usage of the Garcinia. Garcinia is very good. It contains some chemicals. It's very reflected with the neurochemicals. So it is very useful for reducing the weight. It reduces the insulin resistance syndrome. You know very well about the insulin resistance syndrome. It is another condition is called pre-diabetic conditions. It is useful for using the Garcinia camphorgia. Next slide, please. So these are all the unhealthy food combinations also mentioned in our literature, Tamil literature. There is a honey is also elixir. Ghee is also elixir. The combination of honey and ghee equal part is toxic to our system. By the way, milk and greens is toxic. That is fruits and curd is also toxic. We can easily use in your area, there is a mango lassi is very popular. It is toxic according to Siddha system. Palak paneer in North India, it is bad food combination. So these are all we should avoid. Next slide, please. So this is simple herbal combination useful for GI tract and enhance our brain function. Simple combination is the dry ginger, pepper, cumin seed, curry leaf, ajwain, that is the carom seed, asafoetida and perunjeeragam in Tamil, that is the fennel seed. These are all the combination, all the 6 ingredients equal part except curry leaf. Curry leaf 2 parts. So shade dried all the ingredients and powder it. Use it as a mix with the water or mix with the buttermilk, or you can mix with the rice and ghee. Take in the daily basis. It prevents many diseases. This has come under the primordial prevention of Siddha system. Next slide, please. Next. So how to eat? So each and every bite is very, very important for digestion, for the longevity. Not only for the digestion, for the longevity. So how to eat? 50% filled with the solid, 25% with the liquid, buttermilk, water and soups. 25% keep empty. This is the general formula. 50% solid, 25% liquid and 25% empty. How many times to eat? So usually 2 times a day is enough. Morning breakfast and lunch is enough. You should avoid dinner for longevity, but for better health. If you are going to the yogic pathway, you reduce it to 1. So once a day become yogi, Twice a day become bogi. Bogi means a healthy person. Thrice a day become a rogi. More than thrice a day, multimorbidity, palarogi. In Siddha system, it's mentioned at the palarogi. So next slide, please. So once in a week, take oil bath. Oil bath is nothing but the complete detoxification of the whole body. Apply the sesame oil or castor oil or coconut oil from head to toe. Allow it for at least 40 minutes and take a bath with the shigakoi, herbal hair wash powder. So during the soaking time, all the 9 openings, eyes, ears, nose, nail beds, genital organs, private parts, all are soaked with that oil for at least 40 minutes to neutralize the biological energy. That is the kinetic energy, thermal energy, and the potential energy. Neutralize with the soaking, simply soaking with the sesame oil. Next. This is another one primordial preventive method mentioned in the Siddha literature. You can use it in your life. So simple preparation of castor oil, ginger juice and honey. If your home have a kit like for 5 to 8 years, each 1 teaspoon of castor oil, 1 teaspoon of ginger juice and 1 teaspoon of honey, mix with 50 ml of hot water and take it in an empty stomach early morning. So these are all the dosage. If you have 18 to 65 years, each 4 teaspoon of castor oil, 4 teaspoon of ginger juice and 4 teaspoons of honey. It completely detox our whole system. It not only cleanse the bowel, it cleanse not only the physical body, it also cleanse the subtle body, mainly mental health improve with this combination. It is effectively managed by our practice. Next slide. So next, you know very well about the yoga. Next is the belly breathing. Next. So Siddha culinary medicine is also an important part of our primordial preventive methods. It also prevents the many diseases. We are practicing some food habit based on the activity, season and our body constitution. We select some specific ingredients mentioned in the ancient Siddha literature. It prevents many diseases. So we also use it therapeutically. For diabetes mellitus, we use specific diet based on the body constitution. It reduces the blood sugar level without using the modern as well as the Siddha Ayurveda preparations also. So in our clinic, 18% of patients, newly diagnosed type 2 diabetes mellitus patients, no need of medicine, any medicine, modern medicine, Ayurveda, Siddha, Unani, no need of medicine. We are using the culinary practice, we are using the some specific yoga practice, we are using some lifestyle based on the specific body constitution. So next slide, please. Next. These are all some non-pharmacological approaches. It is Panchamutti Kanji, next. It is garlic honey, next. Curry leaf soup, next. It is very unique combination. It is called Idaya Avildam. There is a Ventamarai Malar Amudu in Tamil. There is a lotus beetle. It is the next one is the hibiscus. It is very auspicious in this campus, I think. The next one is the lotus. These shade dried, these 3 flowers mixed with the palm jaggery, honey, we use as a gulkandu. Gulkandu, you know, there is its own elixir. This combination is very effectively overcome many cardiovascular disorders and psychological disorders. So it is useful for brain and heart. Next. So by the way, many decoction and teas are mentioned in the literature. We are using this combination. Next. Next. Betel leaf juice. Next slide. So these are all the natural immune boosters. Spicy powder we already see in the previous slides. Gooseberry salad, ginger tea, herbal water. Simply mix with some herbs in our day-to-day drinking water. It prevents many diseases. One of the important thing is the cumin seed, pepper and thymol seed powdered and mixed with our drinking water. It is useful for prevent many disease. Next. 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 So these are all the non-pharmacological approaches of Siddha system. It doesn't need any oral medication, external applications only. This is poultice for arthritis and inflammation. Next. This is for fomentation for arthritis and cervical spondylosis, sprains. Next. This is you very well known about the steam therapy. Next. Massage. Next. Nasal applications. Next. Eye drops. Next. So we have two organizations, all non-governmental organizations. One is the Health India Foundation, another one is the Global Center for Siddha Medicine and Research. So that Health India Foundation is founded by the modern medicine professor Dr. Devanayagam, is a world-renowned chest physician. He started using the integration of both the medicine, Siddha system with the modern medicine, by reducing the cost of the treatment, increase the efficacy, and reducing the side effect of the treatment. Reducing the side effect, increase the efficacy, reducing the cost. He integrate Siddha system with modern medicine, and we are running that organization. Global Center for Siddha Medicine and Research, we registered in Chennai as well as in USA, North Carolina. So we are giving evidence-based Siddha reports all over the world. So we are running, next slide please. We signed MOU with Manipal Academy of Higher Education. Next. We also, next slide please. We also signed MOU, we are going to sign MOU with the Morehouse School of Medicine in April 2000, next month. So we started 3 Siddha courses in that medical school, that is 4-week elective in-person course. The students of medical college, the medical students are coming to India to learn Siddha system of medicine and disseminate the knowledge. They integrate the non-pharmacological approach and the diagnostic parameters of Siddha system of medicine and practice in USA. It is allowed by US. So Siddha medicines is not allowed in US FDA, by the US FDA, but non-pharmacological approaches is allowed. So the next one is the 4 weeks online course is also available. 8-week online course for physicians, medical students, staff nurse, paramedical students. These 3 Siddha medical course is currently available in the US. Next slide. Next slide. So these 4 students came to our hospital. Next slide please. They are well versed with the yoga. Next. They are well versed with the Varmam therapy. Next is they are well versed in the pulse reading, pulse diagnosis. Next. So next, these are all the Siddha wellness retreat. We are conducting Siddha wellness retreat to prevent many diseases. Next. So early morning waking up, giving the oral detoxification, ginger tea and oil bath, Varmam applications. There's a fire-free cooking and Varmam therapy classes. All are come under that wellness retreat program, Siddha wellness retreat program for prevention of the disease. So more than 300 persons are practicing this Siddha primordial preventive methods in Malaysia. More than 100 persons are practicing these preventive methods in USA. Next slide please. Next. So false lifestyle make a man unhealthy and traditional Siddha way of life can reverse it. Thank you so much for your thank you. If you have any questions, please. Yes.
You said about the rice water, like after you leave it overnight, you just drink that water.
Yes.
Okay, next day.
Yes, next day.
Okay.
Yeah.
Can you do that with brown rice and red rice?
Yes, we can use brown rice, red rice, or bar boiled, hand pounded rice. We can use.
Yeah. Do you wash the rice?
Yes. First, the step 1 is the wash the rice, raw rice, or hand pounded bar boiled rice, and cook it in adequate water. So the rice is soaked in the pure water for overnight.
After it's cooked.
After cook. So the next day, the water is also elixir, the rice is also elixir. You can use the rice for the breakfast. The rice is the early morning water. It enhances the gut microbiome.